Hello, and welcome back to the Revenue Cycle Decoded podcast. I'm your host, Gina Cornett, and we are breaking down all things healthcare revenue cycle. If you work in patient access, congratulations. You are in one of the most important roles in the healthcare system as the first point of contact for patients. And you set the tone for their experience, and you play a vital role in keeping the revenue cycle running smoothly. So, one of the biggest parts of your job is understanding health insurance. And this is important for people in patient access roles, practice management roles, or department management, or in billing and revenue cycle and accounts receivable. So, even though it might seem overwhelming at first, once you know the basics, it's a lot easier to register your patients accurately, make sure their information is correct in the system, and help them navigate their financial responsibilities. So, in this episode, we're going to cover the types of health insurance that you'll encounter, what you need to know about each one when you're registering patients, and tips to handle patient registration like a pro. And stick around to the end for a special resource designed to make mastering insurance even easier. Let's dive in. So, before we jump into the types of insurance, let's talk about why understanding health insurance is so important to your role. When patients arrive for their visit, they rely on you and the practice to get their information right. Mistakes like entering the wrong insurance ID or failing to verify coverage can lead to denied claims, delays in billing, and a frustrating experience for your patient. So, by knowing how insurance works, you'll be able to accurately verify eligibility and benefits, ensure claims are submitted correctly, and explain financial responsibilities to patients in a clear and confident way. The first is private or commercial insurance. Private or commercial insurance is offered through employers, or it can be purchased individually or obtained through the health insurance marketplace. And plans like Blue Cross Blue Shield or Aetna or United Healthcare are common examples. Here's what to know when you're registering patients. On the policy details, double check the policyholder's name, date of birth, group number, and member ID. Small typos can lead to claim rejections. So always check your work because data accuracy is extremely important. In network versus out of network. Make sure your facility is in network for the patient's plan because patients pay less when they stay in network. If the plan is out of network, then they either may not be covered for any services provided by your practice or your facility, or they may have a higher responsibility for out-of-pocket costs, and there may be additional requirements to obtain authorizations or referrals. So on patient costs, be ready to explain copays, deductibles, and coinsurance. And if you're not sure what these terms are or what they mean, I have another video which I will link, and it's a great one to watch to become familiar with insurance terminology. So here's a quick example. If a patient hands you their insurance card, verify that the policy is active by checking the eligibility portal in your system. Or if you don't have access to a portal, you can call the payer. Confirm whether your facility and your provider is in network and explain any copays that they may owe for the visit. Now, Medicare is a federal program for people who are aged 65 and older, as well as some younger individuals with disabilities. And it's divided into Part A, which covers hospital insurance, including inpatient care. Outpatient care is Part B, that covers things like doctor visits. Part C, which is Medicare Advantage, consists of private plans that include additional benefits, and they are usually managed by the commercial insurance companies. And then Part D, which is prescription drug coverage. So if your patient has Medicare or Medicare Advantage, you need to know which one they have. They cannot have both active at the same time. And sometimes patients get confused on this. So always ask if they have a Medicare Advantage plan. If they hand you their Medicare red, white, and blue card, if they don't know, you can ask them, do you have something like United Healthcare or Blue Cross Blue Shield? If they do, they'll pull out that card. But otherwise, you're going to run their eligibility and benefits. And if they do have a Medicare Advantage plan instead of traditional Medicare, it will show up then. So here are some things to watch for. The Medicare card, the red, white, and blue card, has a unique MBI ID. That's the Medicare Beneficiary Identifier. So double check that number carefully. Make sure you enter it carefully and accurately in your system. Now, many Medicare patients do have secondary coverage that's not Medicare Advantage, but it's a supplement plan. And it could be through AARP or some other provider. And these are like a Medigap plan, or they may also be covered by Medicaid through their state if they meet income guidelines. So always verify if they have both primary and secondary insurance and insurance verification and eligibility for both insurances. So Medicare Advantage plans, you're going to treat those like private insurance. They often have additional requirements. Again, you need to make sure that you're in network or out of network, just like with any other commercial payer. And they may have special referral and authorization requirements that have to be met before your patient can be treated. So, for example, if a patient has a Medicare Part C, Medicare Advantage plan through a private insurer like Humana, you'll need to verify coverage through that insurer and not Medicare directly. Now, let's talk about Medicaid. Medicaid provides coverage for low-income individuals and families, and each state has its own rules. But here's what you'll need to do. You need to verify Medicaid eligibility. That eligibility can change frequently. So always confirm coverage for the date of service. Many states do use managed care organizations. So again, the commercial payers would be the ones managing the Medicaid plans in that circumstance. So you could have Aetna or Molina or one of the other commercial payers that is managing the patient's plan. So if that's the case, then confirm which managed care organization or MCO that the patient is enrolled with. It will show on the patient's card. And then authorization requirements. Again, many Medicaid plans require authorizations for specific services or treatments or tests. So if you have imaging or a specialist visit that requires a pre-authorization, you will need to obtain that before you provide service. So remember, one thing, Medicaid is always the payer of last resort. If the patient has another insurance plan, Medicaid will only pay after the primary insurance processes the claim. Now, there are also military plans, TRICARE and TRICARE for Life. TRICARE plans are designed for individuals who are either active duty military personnel or their families. And just like with commercial insurance, there may be special authorization and referral requirements before you can see the patient. Different TRICARE plans may be PPOs or HMOs. Again, my insurance terminology video will explain what those types of insurances are. But essentially, with a PPO, a patient can choose their provider, and with an HMO, they have a patient care specialist who they'll see their primary care, and then that specialist will refer them if they need referrals. TRICARE for Life works with Medicare, and so patients who were formerly in the military may have TRICARE for Life after they have qualified for Medicare benefits. And then there are special guidelines for what gets billed when. And I have a whole course about insurance which goes into that in detail. Now, another insurance that you may see is workers' compensation. If you are treating workers' compensation patients, your provider will need to be registered and enrolled with the workers' compensation plans in your state in order to be reimbursed and see those patients. There are some special guidelines for workers' comp patients, including identifying that the visit is related to an accident or injury that occurred at the workplace and was a result of the patient's job. Also, any documentation related to the workers' comp visit has to be kept separate from other medical record documentation. So, if your patient is being seen for an injury, but also sees your provider for their annual wellness visit, you will want to keep those two medical records separate because we're not going to share the results of that annual wellness visit with the workers' compensation carrier. It's very important from a HIPAA compliance standpoint. Another insurance you could see would be liability. The same rules apply. So if a patient was injured, for example, walking through a door, injured their head, they're brought to the emergency room to be treated, and the homeowner's liability insurance is going to cover. In that case, that will be the primary insurance, even if the patient has other insurance. The same would be true if they were injured in an auto accident. The auto insurance policy will be the first payer on that claim, and then any secondary insurance, any other insurance that the patient has could be billed. So again, you would want to keep those records separate, and you would want to verify the coverage with the liability payer. And you would also need to determine if they have a case manager that is going to be approving services and authorizing treatments and procedures and tests. So last is our self-pay patients. And these are patients who don't have insurance or choose not to use it for their visit. And so here's how you can help those patients. Provide a clear estimate of costs before services are rendered. Discuss payment plans or connect patients with financial counseling to determine if they are eligible for assistance. And they may qualify for retroactive Medicaid or charity care programs. So for self-pay patients, empathy is really the key. And starting the conversation with, I know covering medical costs can be challenging, so let's review the payment options and assistance programs we can offer to make this easier for you. That's a way of demonstrating empathy and concern for their situation. Here are 5 tips to streamline your patient registration. Always ask for the insurance card, and always collect the most up-to-date card and check the effective dates. You're going to want to verify coverage, and the best way to do that is to use tools like portals and insurer websites. You may have access to programs like Availity, but you need to verify those benefits and confirm active policies. Double check your demographics that you've entered. Make sure that the patient's name and date of birth and ID match the payer records. Be prepared to explain copays, deductibles, and out-of-pocket costs to your patient. And document everything. Record those insurance details and verification confirmation numbers in the system. And when you're getting authorizations or referrals, make sure you're documenting those numbers in the registration system as well so that they go out on the claim. If a rep that you're calling for an authorization tells you that no authorization is necessary, make sure that you record in the system the name of the rep, the date, and what they told you. And they should provide you a reference number for the phone call. So if later we submit a claim and they deny it for lack of authorization, then we can refer back to that number. They do record those calls so they can see what was stated by their rep. So it's just important to note that registration errors can lead to billing headaches down the road. So taking an extra minute to confirm the details up front really does make a huge difference. So if this overview was helpful, Imagine having all the tools and knowledge you need to master patient registration and insurance verification. And that's why I created my Insurance 101 for patient access staff, and why I am also creating the patient access module. Both of these modules are part of my overall revenue cycle bootcamp course, but I have also broken them out as individual modules if you only want that content, and you can take them separately or you can bundle them together. And they will provide you a wealth of information and practice scenarios to help you perform your patient registration, patient access job better and understand insurance and patient access responsibilities. So these courses do a deep dive into the key differences between Medicare, Medicaid, commercial, liability, workers' comp, TRICARE, and self-pay patients. And we talk a lot about how to verify eligibility and some common registration mistakes, and then best practices for explaining financial responsibilities to patients, including some scripts for you. So click the link below if you would like to enroll and become an insurance expert in no time. We'll set you up for success in your patient access career. So thank you so much for watching. Understanding health insurance is one of the most important skills you can develop as a patient access professional. And I hope this video gave you the confidence to handle registrations like a pro. Don't forget to like, subscribe, and share this video with your team. Let me know in the comments if you have any questions about insurance types or patient registration. And you can also reach out to me on the Revenue Cycle Bootcamp Facebook group. I would love to help. So see you in the next episode. Until then, peace out.